Many families are caught off guard by the jump in price of some life-saving children's medications like epinephrine or EpiPens. Some are forced to ration the auto-injectors or go without them. Some experts say families have had to shoulder more and more financial responsibilities over the past decade, especially as high-deductible insurance plans have become more common. In-depth analysis from Paul Seegert, managing partner at PCS Advisors. Paul, what's happening?
Folks that are getting epinephrine shots, depending on the plan that they selected at this recent renewal cycle, whether that's through their employer or on the individual marketplace or wherever, sometimes they end up picking a plan with a very different amount of coverage or a high deductible. And and especially if that's an HSA style plan where they have to pay all their medical expenses up to a certain number, whether that's a few $1,000s or even more, they may be on the hook for the actual cost of a drug. In this case, it's epinephrine shots that was featured, but it could be really anything. And they can get a very big surprise when they go in the month of January to fill their prescriptions that they may have previously had access to for a $20 copay or $30 copay or $10 copay or $50 copay. They may now see what the system has been paying and what their insurer has been paying for that drug. It's not uncommon. You can have a drug that's $600 or even $6,000 and you had no idea.
Goodness gracious. How would you have an idea, I guess, right?
Well, exactly. That's the challenge we face in our system, really, is that you have consumers who are consuming a product in terms of their copay and deductible healthcare that has no relation to actual cost, which really puts them in a difficult position to make a good decision at renewal. And oftentimes, every year we'll see people who pick a plan because the monthly premium is lower, but they have no idea what they might be getting themselves into because in their mind, these epinephrine shots are $30 each time they need them or whatever their copay was. And there are many, many drugs. There's a big pipeline of drugs. We've approved 4 since August that are north of $2 million, which is obviously the extreme example, but many, many drugs are tens of thousands or even over $100,000 a year.
We're speaking with Paul Seegert, managing partner at PCS Advisors. We're talking about price hikes for life-saving children's medications, especially epinephrine. So if you're a consumer, can you, and you're thinking of changing plans, can you specifically, I guess you can, right? Can you specifically research that and ask your insurer, like, how it would work if you need this specific drug?
Yes, it may not be that easy, but you need to, and it may not be the insurer that's going to help you the most. It might be that you have to actually ask the pharmacy. Hopefully, you have some sort of an advisor involved in the health plan that you're a part of. You can reach out to them or their office and get some input. But it's absolutely an area where we need, as consumers, we need to do more research. It's something like 15 minutes that the average American consumer spends picking their health plan for the year, and we spend more than that for a TV or a vacation or whatever. Right. My spouse spent all day yesterday looking at our spring break vacation, and I can assure you we did not spend that much time picking our health plan for the year.
Right.
So it's something we need to focus on more.
Right. Guilty of same here. So this one family that was profiled in the story we were looking at, this family is looking for the epinephrine shots, typically $30 for a pack of 2. Now, under the newest plan, $600 a pack for 2. I guess it's not just for EpiPens and Epi shots too.
No, it's really across the board. And what is happening is this consumer is now, because of the style of health plan that they're in, they're on the hook for the entire cost of the drug until they meet their deductible. And they're getting to see how much the system is paying for these drugs, and that's there. I guess it's unfortunate that this is happening. The good part of this is we can put a little bit of a spotlight on this because in some cases it's reasonable to ask: is that a reasonable cost for this drug? Yeah. And we need to do something about that at the system level because it's always baked into our renewal premium increases each year, whether we see it or not.
Is there a solution ahead anytime soon for this type of stuff?
I don't, with the dysfunction we've been witnessing at a national level, I doubt it.
Thanks, Paul. Paul Seegert, managing partner at PCS Advisors.